I'd start even earlier and say, for those who are considering a healthcare profession career, pharmacy is outstanding. I think there's a number of different areas within healthcare that young students can migrate into, but boy, pharmacy is a terrific profession that allows the individual to go in almost any direction that they want. So that you get tired of one area of pharmacy, there's 100 more different directions you can go in. For the students who are in school, I think I tell them this every day, that grades don't matter that much. You got to understand the information, but learning how to practice is really the most important part, I think, of what we do in school. So the information that you learn is not just to regurgitate on a test, it's really to take care of the patient next week. And so think of it that way and not simply focus on facts and figures and how much you can cram into your brain, but really it's, how can I use this now to go on and take care of patients? I think for the young practitioners that are just entering the profession now, a couple thoughts, one of which is continue to learn and grow, innovate yourself, because over a 40-year practice career, there's so many different directions in which you can take your, take that career. You want to be prepared, and it's hard to prepare when you're 20 years into it. So early on, build the foundation as wide as you can, so that as you grow over the course of a career, you've built a foundation that can hold all of where you want to go. And the second thing is be creative and be innovative. We have a more balanced workforce now between supply and demand. For many years in pharmacy, there was just tremendous demand. We couldn't graduate enough pharmacists. Every one of them got, I'll say, snatched up into traditional dispensing roles. And I think that's an important component of what we do. But now that we have a little bit more balanced workforce, we're seeing more learners go on for postgraduate education, more of our graduates going into really innovative, creative pharmacy practice experiences. 50% or more of our class will go on for postgraduate training of some sort, residency, fellowship, graduate school. You never saw that before. And so those guys are going out to be even better prepared to change practice, change healthcare, be really creative and innovative for the future. As a young practitioner, you want to be prepared to, go in whichever direction we're needed to go as the needs of healthcare in the country change over the next 10, 15 years.